close. Bellafill is a filler. It's white. It's thicker in substance because it's one of the only fillers that have collagen in there and little beads that help build collagen over time. If you look at his skin here, he's been doing lasers, but he works out in the sun so he gets pigmentation. And when he gets that pigmentation, the laser improvement is still there, but now we can see some of the irregularities in the actual texture of the skin because of the pigment that's there. So now this is a perfect time for us to address the indentations or atrophic scars with Bellafill, which is a filler. We inject this really superficially under the scar, and I do it a little bit different. I do a smash technique. So I go right under there and I just smash. And I find that because, like I said, this filler is like a web, it just plumps that out and builds collagen there over time. And remember, small quantities of this permanent filler will give a long-term result. Large quantities of this can actually cause a lot of problems, like lumps and bumps. So as long as you're doing little bits, let me go ahead and hold from here. No, use that one. Mm-hmm. Or it doesn't matter, give me that one. There you go, hold there. We'll keep moving. And we're gonna go right underneath each of these little ones and just do little bits and just kind of very small aliquots, you guys. And these little aliquots will just basically create a scaffold under the skin and build the collagen there. We just did some subcision on him and he's been doing a couple strong laser treatments that everyone's been following. He's done really well. It's just now there's some lost volume, there's some laxity in the skin. So all that really just needs to be addressed by filler. And for him, I want something more long-term, more substantial. That's gonna really help him. And so we're doing these micro aliquot injections every so often. How much he needs will be hard to say. We just have to build this over time. And the one thing that everyone always asks is cost and time. No scar is gonna go away in one treatment. Turn towards me a little bit, turn towards me, there you go. And you're gonna need to do building. It's like working out. At some point you plateau, you might need a different laser. Or at some point you age a little bit, you might need more filler. So it's gonna be a kind of a lifelong thing, but each time we do it, we get some level of improvement. Let's go back now to the temple, you hold there for me. So this area always tends to want to bruise. We're going to hold nice firm pressure. And make sure you come on in close. Don't stay far, always close. Let me see here, I can get this. And you can see already much more filled out. Very hard to do a cannula unless you're doing it with subcision for acne scars. So I always tell people, we've already did a subcision, it's improved, now let's build. Let's see over there now, a little bit. Good, hold that spot. We're just kind of micro injecting some of those deeper areas and scaffolding the scars. He's gonna do great. Perfect. Okay, so now I have him hold, I got this, with his left hand right there. Perfect, turn your hand to the left. Now we're gonna go to the opposite side. Go ahead and grab the next one. And you can see here the majority of his irregular texture is up through his temple area and a little bit through here. Now the interesting thing, you guys, with most laser procedures, white scars, or what we call pseudostellate scars like this, do not improve. With that said, his have improved with the profractional deep erbium. So, you know, if he was out of the sun more, we would notice more improvement, but this is actually good in his benefit because now I can see some of the more irregular texture and get more of a long-term improvement for him with the volume component of his scars. And again, little bits into each of these scars, right underneath them, creating a scaffold. Any questions on there?
Not yet.
None?
You said, yes, there's one as soon as you said it. What's being injected for scars?
Okay, so guys, this is Bellafill, which is a collagen stimulating long-term filler that's used for acne scars. And he's already had a little bit. I'm gonna do that from on that side, from underneath. Yeah. Perfect. And we're doing little micro injections. A lot of studies show that micro aliquot dosing of these types of fillers are safe, very predictable, and give very long-term results. So I'm kind of seeding the area. Always hit this superficial transverse facial vein. It's that little bloody one we just saw right there. And that's it. We're gonna keep doing that, and then we're gonna watch him over the next few months as this improves. I want to hold down, we'll show the other side. So now, hold now with your left hand, or your right hand, right there, perfect, turn to the right. You see this side, and he's gonna have little bruises, and it's gonna look a little puffy, but if you see, now, this texture, ignore all the little bumps, is significantly improved. And that will build over the next 6 to 12 weeks. So that's Bellafill, you guys, for acne scars. So give him some ice, have him hold the pressure.